anyone out there with a disease problem, with a joint or spine problem, with who just really wants to be on top of a plan to live longer. Maybe you have 13 grandchildren and you want to see them all, grow and develop, and you want to be on this planet longer. You have to do the work. And
Mm.
you can look at regenerative medicine or stem cell based options. And if you ask your doctor, and the doctor is not trained in that, because I wasn't originally trained in that, I had to go back and do that. Um, you just need to ask another doctor.
I can't wait to talk about this really interesting topic. And for me, I have to admit, it's very mysterious. It's something I've never really looked into a great deal myself. And that is stem cell therapy, like regenerative medicine, and this whole kind of area that I feel is becoming more and more popular. But am I right in thinking that stem cell therapy? So I thought it was this new kind of way of helping people overcome their health issues. But am I right in thinking that it's actually not that new? That it's actually
It's not,
decades and decades old?
yeah, it's not that new, and it's really sort of tapping back into nature itself.
Mm,
So it's something that's we have been benefiting from for generations and hundreds of thousands of years and beyond. But we're only now able to strategically use that knowledge at the
mm,
cellular level to help us repair, replace, help us heal, help us regenerate like we did when we were younger, because we do it all the time. We're
mm.
kind of constantly replacing our tissues and our cells.
Right. I mean, if you
You
cut
make
your
new,
finger, it just heals. And that's an example.
yeah, exactly. You cut yourself, or you don't know it, but you're making new liver cells and skin cells, dry skin that the surface comes off because you're making new cells underneath, and we're constantly renewing. We don't do it as well as we age because our cells accumulate this damage, this exposure to the environment that we call chronic inflammation. So our own stem cells become chronically inflamed and don't work as well. They become exhausted. So that's why children don't usually need stem cell type therapies because their stem cells are young and robust, right?
Mm,
And the stem cells created us in the first place. When you think about the miracle of actually creating a human from a single fertilized cell, I mean, a fetus and a baby, and I mean that's all stem cells. So we maintain those as adults, though they're constantly working, and we can stimulate them by doing healthy things, by eating properly, by sleeping in a restorative manner, by exercising, by hot sauna, cold
mm.
plunges, fasting will stimulate your stem cell activities. Certain other nutritional elements will do so, but sometimes that's not enough, and that's where the medical side of regenerative medicine comes in.
Mm. It's so interesting. It's actually funny the way you've just described it because it's not a case of, oh, it's been around for decades. It's actually the stuff that we're made of. This is what our body does. But your point is that as we age, we're not as good at regenerating our cells. So that's when the newer technology of strategic regeneration using stem cell therapy, that's where it all comes into it. So it's so interesting. I also love how you've already dived into what I love. Like I love talking about exercise, nutrition, cold plunges, like all of those things that really get your body stressed out in order to
Yep,
help it come back stronger and heal better. So I
exactly.
can't wait to come to that towards the end. But what I wanted to start with, so anyone who's like me who has no idea what this topic is about, I mean, I'll tell you the extent of how I came across stem cell therapy. So I came across it when I was 33, so I'm nearly 40 now, so about 7 years ago. And when I had my child, they said, "Oh, you have this option to save your umbilical cord and placenta." And
Right.
it's something about stem cells, blah, blah, blah. And at the time, I was like, oh, that's a load of rubbish. Like, I'm not going to pay for that. Um, but I mean, so your advice, first of all, Jeff, should I have saved my placenta, or is it not the best source of stem cells?
It's a great source of stem cells, but you
Right.
don't need
Damn.
to match your genes or your own type of blood or your child's blood with yours. You can use, and we use them all the time, off the shelf donated umbilical cords, and we call them perinatal products, right?
Mm,
The placenta, the amniotic fluid, the umbilical cord, the jelly in the umbilical cord. All this is rich with regenerative biologics like stem cells, growth factors, all the good stuff. Um, you can save yours. There's nothing wrong with that. And you can use it not just for your child if they need it, but you can use it for family members and others. But it's expensive because it has to go to a bank, a stem
mm.
cell bank. It has to be, if you need those cells, there's a cost to have them, you know, grown in a petri dish and what have you. So it's actually quite costly. It's
Mm.
There's nothing wrong with it whatsoever.
But
Um,
it's okay that
but
I didn't save it because I
it's
was kind of
it's
kicking myself afterwards.
no, it's completely okay. The very rare need for your child, the reason why people started doing this, 20, 30 years ago, was the very rare need for a complete bone marrow replacement. If the child were to, God forbid, ever get leukemia and they wipe out the bone marrow and they replace it, you would have to have a match. So that's this usually the purpose for that, saving that. But it's an expensive insurance policy on that.
Right. Okay. So the term stem cells, regenerative medicine, can you demystify these terms?
Sure.
What is regenerative medicine, first of all? And what the hell are stem cells? Like, what are they down to a cellular level? Like, where are
Right.
they? What do they do? Okay.
Great. All right. So this is everyone. There'll be a quiz at the end of the podcast. So take note. Regenerative medicine is the strategy of using stem cells or signaling factors and growth factors from stem cells that we call regenerative biologics, is using that strategically to help someone who needs help, is not whose own body is not able to do what it did when it was younger. And that doesn't mean it's just for older people. I mean, I have people in their 30s who have, let's say, an old joint injury, and the joint just it's had too much trauma, and maybe it's had some surgery, and it's just not able to regenerate itself. That person needs a boost, a help with regenerative medicine. So the basic building block of regenerative medicine is a stem cell. Now our bodies have stem cells. They exist mostly in the bone marrow. There's some in the other tissues. The fat has some. They live around the arteries, as well, and they're called upon when signaled for. And some of us are better than others at utilizing our stem cells. And the stem cells can divide and become a tissue you need. Do you need a liver cell? Do you need this type of muscle cell? That kind of thing. It can also help support and heal by fighting inflammation. If you really think the body's doing one of two things, it's either defending against the environment, and that could be things that should not be in our food source, things that should not be in our water, things that should not be in our air, all cause oxidative stress, all cause, degenerative changes in the cells that we call chronic inflammation. Or your cells could be the opposite. They could be, instead of degenerating, they could be regenerating. They could be um, anti-inflammation. And you think about all the healthy foods and good things we do: fight inflammation, fight oxidative stress, antioxidants. So the cells are usually in one mode or the other: degenerative, oxidative stress, or regenerative. So stem cells and signaling factors do that by fighting inflammation. And one of the most powerful anti-inflammatory and anti-aging things your cells can do is to be influenced positively by stem cells, because they really encourage all our cells to act well, not just replace tissue. Now, if you cut yourself and like you said on your finger and you want to heal that, then of course there's a whole cascade of inflammation, and then you want to turn off that inflammation. That's where the stem cells come in. But when your stem cells don't work as well, then you get problems of chronic inflammation, like ages of disease, coronary artery disease, hardening of the arteries, Alzheimer's, type 2 diabetes. All of these are diseases of aging and aging related to disease because of inflammation. So our stem cells help fight against that until they can no longer do it as well. Well, regenerative medicine and stem cell medicine comes in to help us fight that and is a game changer for some people in these arenas.
So we're born with lots and lots and lots and lots and lots
Yeah.
of stem cells, but then as we age, they get less and less and less. And the stem cells help you to heal, they help you to regenerate, and they sort of lie dormant until they're needed. Like let's say you're
Right.
injured, then they just like,
Right.
okay, send them out, heal. Um, so is aging because the stem cells aren't as efficient at regenerating our cells?
Yes, that's one of the main theories of aging,
Right.
but it overlaps with the theory of accumulating this chronic inflammation.
Yes, the
But they
chronic
go together
inflammation.
because as your stem cells get exhausted and less populated and less effective, because they're
Mm.
also subject to chronic inflammation, the inflammation goes up. So inflammation and stem cell decline move together. And and most people looking at aging at the cellular level say
Mm.
it's an accumulation of inflammation. And some people actually call that inflammaging,
I
which
was
is a
going to
smart
say,
word.
do you like that term?
I do.
So you do
Yeah.
like that term, yeah. I came across it the other day when I was doing a little research, and I came across inflammaging. I just thought that's such a great term.
Yeah.
But when you mentioned where stem cells are stored and where they come from, so you said mainly bone marrow.
Right.
Um, I was talking to a friend the other day, and I apologize if this is a little bit crass, but I was talking to a friend and I said, "Oh, have you heard about this stem cell, therapy stuff?" And she's like, "No." She's like, "But oh, stem cells can be found in menstrual blood. Now, is that
Yes,
true?
it is true.
Can that be
Uh,
used for stem cell therapy?"
It is being used in certain circles, but it does require a bit of work because these cells have to be extracted and separated out from the menstrual blood. But yes, it is a source of stem cells.
Oh, I did not know that. She said that there are some tribes out there who they collect menstrual blood, and
Yep.
whenever there's sort of journey that they have to go on, like long walks and things like that, then if they injure themselves, then the menstrual blood kind of helps to cover up and heal
Yes.
the injury. So,
Yes.
it has been, it's almost like innate, like people just know this. They know about
Right.
stem cells and regeneration and how, it helps to heal, which
Correct.
is really fascinating. Yeah, go on.
Yeah. So that's it's published. It's a known thing. And listen, you can collect stem cells from urine too. There are doctors who do that. It's just, it probably has a stigma of what are you using?
Right.
So
Is that why you wouldn't
uh,
use it then? Is that the only reason?
I don't know the processing and what have you. It's let me just make it very simple and demystify this element of stem cell medicine is stem cells and related biologics are so easy to get from donors from the most youthful source and useful source, and that's donated by a mother who's having a child by C-section. So she has her child, congratulations. Instead of throwing away the placenta, the umbilical cord, the amniotic fluid, it's simply donated. And it's a robust method, an easy method of collecting the freshest source of regenerative biologics because they're day zero. They haven't been exposed to the world yet. They haven't been ruined.
Hmm. Can you use, okay, is there one type of stem cell or are there many types? And if so, which do you use
There are
typically?
many types of stem cells, and let's separate out when you are forming as a fetus in your mother, you're mainly made up of what's called embryonic stem cells, and those start out at the single cell level, dividing into two cells and four cells, and you become a ball of cells, and then it flattens out and starts to look like, a shape of a lizard, a tadpole growing into a frog type of thing until you're more humanoid. Well, those go from omnipotent stem cells to pluripotent stem cells to finally the type of stem cells we maintain as adults called multipotent. They can't make a whole human. Um, and then at the pluripotent cells, they might be able to regrow a limb, but we don't use those yet, except in very certain circumstances where multipotent cells can be reversed backwards along their embryonic lineage to these pluripotent cells, and now there's a lot of research in that area. But what you find in the community for use for therapy right now is the multipotent cells because they're safe. They cannot, create an accidental second human or a limb will grow
Right.
out of your liver or something.
Oh, interesting.
So,
Yeah.
but when you start to ask about limb regeneration and regrowing organs and stuff, this research is very useful. So we have what's called multipotent stem cells, and then from there are different types. The most commonly used type is called a mesenchymal stromal cell,
Is this the
and this
MSCs
it
that
is
I've
the
been reading about? Right.
MSC, yes. So MSC is mainly most of the organs and connective tissues are MSCs. The types of tissues that aren't directly stimulated by these are those of the neuroendocrine system, and that would be like the brain, the spinal cord, the nerves, certain cells that support those, but not all, the teeth, and then the endodermal system, which is like the center of our spinal discs and a few other oddities. But the vast majority of our cells are from the mesenchymal layer and are stimulated by mesenchymal stromal cells. The middle layer of the embryo called the mesoderm, that's where those come from.
Okay. And they're the ones that are used mainly in stem cell therapy.
Yeah, almost 100%. There are some areas where some dentists are using the neuroendocrine derived cells. There are some products that come from all three germ layers, but they're all multipotent, so they're safe to use. They have not been shown to cause any problems. Uh, and these are what we have available and easily available to us because they come from the perinatal, the placenta, the umbilical cord, and amniotic fluid. They're not from any embryos. So there's this myth that, there's some unethical
Mm.
behavior where people are harvesting embryos. That's not the case, at least here in the States.
Is stem cell therapy a bit taboo still, would you say? Or is it becoming a lot more demystified?
Some of each. I think it's taboo because people don't understand it well. But as we demystify it and
Mm.
demythologize it, I think we can help, remove these unnecessary and unwanted taboos. And that's one of the reasons I'm here talking to you today. And I
Mm.
like to talk to others is to help educate people as to these options that can be available for helping patients, meet their healthcare needs and desires.
What is the scope of this then? So what kind of conditions can someone get stem cell therapy for?
Well, we do it for, significant disease issues to help people with their body to address a disease because they're not able to address it as well on their own. Sometimes that could be a very focal issue, like a knee degeneration, and one of the low-hanging fruits in the regenerative medicine world is joint and spine problems. Um, all the way up through, recovery from heart attack to stroke, Alzheimer's, anything with an inflammatory component. And then we have our group of enthusiasts, our biohackers who do IV therapies just to help keep their cells younger. So the anti-aging therapies, and I will admit I do those myself.
I was going to
I
say,
have
do
an
you do
IV.
it?
Yeah, I do. Every few months I do an IV,
Yeah. And
and
how do you what's your feedback? What's your personal feedback?
yeah. I mean, I have a boost in my energy, in my motivation, a few aches and pains I've accumulated over the years, mostly quiet down. I can get more out of my exercise, my workouts. I'm less sore after my workouts. Um,
Is it
the
expensive for an
well,
everyday person?
yeah, I mean it depends on what you're doing, but so it's dose dependent, and I purchase the doses from reputable certified labs here in the States. So an IV might be as low as just under 4,000 US all the way up through 9,000 US depending on the dose. A joint procedure might be a little more because we'll use multiple doses and we do it at an injection facility, so it's sterile and all that. So the range is not bad. When you look at a health insurance deductible or the cost and downtime of surgery with risks and
Mm.
pain and physical therapy, it's worth looking at.
I mean, when you talk about the people who are helped by stem cell therapy, I would definitely, I mean, I could see it in your eyes when you said the biohackers and that kind of bucket. I fall into that bucket. So I would never call myself a biohacker because I just feel like I'm not that cool. But I am interested in longevity. I'm obviously interested in health. And, I try and stay as fit as possible. I try and eat as well as I can. And I'm very interested in, like we said in the beginning,
Yeah,
healthy lifestyle practices. So I'm interested in anti-aging and how that actually works. So obviously, aging is
yeah,
it's an inflammatory condition. Like we're
yeah,
basically
it is.
becoming more and more inflamed, is
Yeah.
is what I get from you. So how does it actually work? How do the stem cells help with anti-aging? Because isn't anti-aging everywhere? Isn't aging happening everywhere? So therefore,
Sure.
how does a UV address all of those things like your skin, your blood vessels, your, you know, hair and so I mean, how does it all work? Because as you can tell,
Well, it's all at the cellular level, and most biohackers, including yourself, uh,
mm.
you know, uh, understand that if you treat your cells well, your body, your organs and body will be healthy. And yes, you eat right, you exercise, you take care of yourself, and it's for your body's health, but it's for your cells. You're treating your cells, and I think most biohackers sort of know a little bit about biochemistry and molecular biology. They have to, and they understand that they want their cells busy in the anti-inflammatory mode because that mode is the most optimal mode. The cell is more efficient, the mitochondria are healthy, your immune cells are better at clearing out senescent zombie cells that take up space and resources, but should be recycled. So the cellular population of your organs is a much younger population with newer cells with better telomere length and all the markers. So we love to do biological age tests,
Mm.
on people because this is, a better way of measuring their effective cellular age compared to their calendar age. And then we can do a series of treatments, lifestyle interventions, nutritional advice, etc. And then, 6 months later, we can repeat that age, biological age test. And we try to take people who are effectively older than their stated age and make them younger than their stated age. That's our goal.
I mean, like you just said, you can't use stem cell therapy to cover up a bad lifestyle. So you advise people on how to eat, how to live well to support the stem cell therapy, but it's not like a band-aid, is it, to just cover up a
Uh,
terrible lifestyle?
it's not a great band-aid because if you're going to spend and invest in
Mm,
this type of treatment and you're not doing the work on your end, you're not going to get the most out of it.
right. So you said people's biological ages. So do you have any cases that are really fascinating? Like what have been some of your best results?
Yeah, I mean, we've taken people in who are, on the calendar in their 40s who had biological ages in their 70s. And we've been able to get them down into their 30s. So that means we've reversed a lot of activities and lifestyle and used regenerative medicine to do that, as well as various other coaching and techniques. So it's a combination of things, and but they need to maintain it. So it's some effort, it's some work, but those who do have goals about longevity and health span, which is healthy longevity, um, have to work at it.
Hmm. Is it a one-time treatment? So just say someone does have joint problems or, they want to reverse their age. Um, is it a one-time treatment? You mentioned that it's kind of ongoing. Does it need to be ongoing in order to maintain the results?
Um, well, not necessarily. For example, a lot of the joint work we do is a one-time treatment.
Hmm.
We want to help that person regenerate some cartilage and then repair a joint, and then they're back to the normal programming. So if they injure the joint again, of course, we might see them, or they may now degenerate at a slower pace, but it still degenerates. Then maybe they'll come back in 20 years or something. For those who are more the anti-aging enthusiasts, the biohackers, we tend to do repeat IV treatments to help maintain that suppression of age-related chronic inflammatory damage.
How is this risky? I was going to say how risky is this, but that kind of implies that it is risky.
Yeah.
Is it risky? What are the risks that
Well,
people need to
listen,
look out for?
anything you do in medicine has potential risks that we talk about. That doesn't mean it's risky. For example, if you take an aspirin because you have a headache, there are risks of taking the aspirin. You could bleed too much, something like you could develop acidosis, But by and large, that's not an issue if you take the standard dose. It's similar with regenerative medicine. Most of the risks involve the procedure itself. So an IV, pain from the IV, maybe an infection at the IV site, something like that. But we haven't seen those. Of course, they're possible, but we've never seen any type of interaction. Now, having said that, we don't treat anyone with an active cancer diagnosis with regenerative medicine yet. I say yet, it's because we don't have a full understanding that what we're using will or will not stimulate the cancer in the wrong way.
Hmm.
There's some evidence that it will potentially suppress it. There's some evidence that maybe it won't. So, because we don't know, we're just being safe. Now, in addition, we're using rather generic off the shelf components. Now we can, and we're working with labs to have a filtration of the type of stem cells and biologics from the immune system. There are a type of cells that circulate in our body from our white blood cells called natural killer cells, and those cells are for short NK. Those NK cells go around the body, and their job is to find error cells. They find senescent cells, they find cancer cells that we make all the time by accident and selectively remove them. So soon we will have access to these NK cell stem cells and activated NK cells that we will be able to use for people with cancer so we can help augment their treatment in a more natural way, more logical way. So backing up to your original question, are these risky? I do them myself. We do them on so many people. We have not had any issues. There's no rejection because
Mhm.
they're so neutral to the immune system. So I would say, by and large, they're the least risky thing we do. I've done surgery, we've done medications,
Right.
injections. I would
Yeah.
say I would say the regenerative medicine are the least risky medical endeavor I've involved in.
What about risks when you're shopping for the correct clinic? Is there, is, can every clinic be trusted, or are there things that people need to look out for? Are there people out there who are doing stem cell therapy, but they're not really doing stem cell therapy? Is there something that people need to look out for when they're kind of shopping around? Because yeah, there's always times when you can't trust where you're getting such a product. So is it the same with stem cell
Ah,
therapy?
no, I think that's a fair question, and I think it goes with any aspect of medicine. If it sounds too good, if the clinic or the doctor's making claims that, oh, I'm going to cure something, that's probably too much. We like to help your body using regenerative medicine help itself. We don't want to make any claims that we can cure or treat something. We want to help. We want to help your body. So, and that's important, especially in the U.S. We're not able to make those claims presently. So a lot of the overseas clinics, a lot of Central America, clinics, for example, will make certain claims, and the other. So you need to listen with the same amount of you know quizzical nature you may have as you would in any circumstance. And then the second thing is what regenerative biologics are being used. Where did they get them? How are they tested and screened? Do they meet some type of protocol? What is that protocol? Who's the governing body? So in the US, we have the FDA, which certifies all the labs that prepare these biologics. And every time we get a dose that we purchase, it comes with a 2-page checkoff sheet, tested for HIV, tested for hepatitis, tested for et cetera, et cetera. So we know everything we get is tested, screened, and safe, for our own use. So I think those are the two biggest things would be, claims, does it sound too good to be true, and safety and vetting of the actual product.
So just say somebody's listening and they're like, oh, this is interesting. So maybe this is something I'd be willing to invest in the future. But just say they can't quite do it yet. Like they don't have access to a clinic or they don't have the money readily available. You were talking about how stem cells, we have them already, and we're born with them.
Right,
And just off the top of that, I read something just before we came online that we're nothing but stem cells when we're an embryo or something.
right.
So, like, I mean, it's not it's basic, and we've got them already. So, I can imagine that someone who ages quicker than someone else, it's because their inflammation is more advanced,
Right.
which probably means their stem cells aren't doing their job as well as the other person who's aging well.
Correct.
So, so just say someone is on the fence at the moment about the actual therapy itself. How can someone naturally, just in the meantime, naturally increase the function of their stem cells? Is it
Yeah, well,
possible?
oh, of course it is. You can exercise, high intensity exercise, weight bearing. You can fast, a 72-hour fast, a few times a year, maybe intermixed with a few 24-hour fasts.
Yeah.
You can intermittent feed. Some people call that intermittent fasting or circadian, dieting or circadian eating, meaning eat when it's light out, never eat in the dark. Um, you can do hot sauna. You can do cold plunge. Uh, so all those things are called hormesis or hormetic activities. And
Right.
like you said earlier, it's a slight stress on the body
Yeah.
that helps suggest to the body it needs to release stem cells. Um, you can also eat stem cell signaling factors by eating phytonutrients. Fruits and vegetables have a lot of these. Eating bone marrow or bone broth. Colostrum is another way to get some of these signaling factors. Those chicken soup. When you're sick, your grandmother makes you chicken soup because for generations they knew there was something healing about it. Well, it turns out it's chock full of the bones from the chicken stock have bone
Mm.
marrow, and bone marrow has stem cells, and those stem cells give off signaling factors. The cells probably die in the boiling water or digested, but the signaling factors don't, and they can stimulate our own stem cell activity.
Wow.
Yoga, flexibility, mindfulness, restorative sleep, these are all ways to stimulate your own stem cells.
Wow. Okay. So first of all, I'm happy to hear about the bone broth because I happen to have some this morning.
Right.
Um, so I'm very happy to hear that. I'm happy to hear that my age is reversing currently, which is good to know. Um, it's interesting that the activities that stimulate stem cell activity are stressors. And like you said, hormetic stresses, which means hormetic means it's a positive stress. So it's
Right.
something that's good for your body. And this is why, I guess, because it helps stimulate stem cell activity.
Right.
Why is that? So this is probably a complicated question, but like, why is the stress so important? Like, how does that trigger the stem cell activity? Like, I
Well,
mean,
our bodies have uh, this unique adaptability and response mechanism for survival, and that survival requires us to be able to move and seek food and shelter and things like that to survive and to reproduce. And to do that, it has to maintain itself. And that maintenance,
mm,
that self-maintenance system has individually signaling inside the cell. So we're going to get deeper into biochemistry here, but we're
yeah.
talking about mTOR signaling. mTOR is the mechanistic response of rapamycin, and rapamycin was identified in the island of Easter Island or Nui Nui, Rapa Nui Nui. And so they call it rapamycin, and they thought it was an antibiotic, maybe an immune suppressant. Turns out it helps the mTOR pathway to suppress inflammation if it's done properly. So that's a common mechanistic therapeutic action of rapamycin, but it turns out many pathways in the cell can trigger this. All the hormetic activities tend to work in that way. So what's rapamycin? It's a drug. And it's a drug that was found to be naturally occurring, so it's sort of a natural drug, but most drugs have some basis in that. And you can take it as an anti-aging therapy of sorts. And you can get it. It's available. And people will do courses of rapamycin to help suppress inflammation. So I know I sort of went off topic here, but all these hormetic activities work through these anti-inflammatory pathways, and they stimulate uh, stem cell activity and stem cell release. Like the body has that reserve, and it's called, that's the signaling to call upon those stem cells for survival.
So our lifestyles, a typical lifestyle these days is very comfortable. So we have, if you're in a hot country like myself and you, if you're in a
Yeah,
hot state,
right.
air conditioning, people have central heating if they're in a cold area. We have sofas and couches and Netflix and food at hand. We don't need to go anywhere for our food. We can just pick it out of the cupboard. So really our lifestyle in general is going completely against our biology and it's actually increasing aging. Would you say that?
It
Yeah.
is. It's amazing. I mean, that's quite profound, Tamara, what you just said. Our lifestyle is going against our biology is absolutely true. We've become, biologically lazy with the comforts of modern life. And now, good medical care has improved at least in the modern world, the the life expectancy, but it's sort of reached a peak. And that peak is because it's being held back, I think, by exactly what you said.
Mm.
That we're now going against our biology. Uh, so you're right. And in the way we must get up off of our chairs that we're sitting in, both of us right now,
Mhm.
we must move, we must do exercise, and that's the best thing you can do. Exercise, move your muscles, re release the myokines, the small peptides from the muscles that signal the body to be healthier. It helps prevent dementia, for example, helps prevent cardiovascular disease, helps suppress inflammation, helps slow aging. If you see an active 80-year-old compared to an inactive 80-year-old, you can tell the difference on how they look. The inactive one looks older, just the skin, everything. So I think we need to get up, we need to move, we need to pretend we have these hardships, and that's what hormesis is. So we've
Right.
kind of gone full circle to
Pretend. Yeah, right.
modern conveniences to, well, I guess I got to go exercise.
And
Got
now
to
we've got to
stress my body.
pretend. Yeah, now we've got to pretend that like that
Right,
we're living the life
exactly.
that we really should be. It's very strange, isn't it?
It's a stimulation. It's like an astronaut on the treadmill, right?
Oh yeah.
It's exactly
Yes.
what it is.
Yeah. Um, and yeah, I can't remember what I was going to say to that, but whenever I look up natural ways to stimulate stem cells, I keep on coming across the word ketones. Now, what's the story there? So ketones, keto diet,
Yeah.
like it's is there something about that?
Yeah, I mean, listen, sugar is public enemy number one, and it is a very pro-inflammatory molecule. It tastes good, but we
Mm,
were not biologically meant to consume sugar like that. At best, some fructose sugar from fruits. Um, but all of this refined sugar and seed oils and things like that have caused our body to have to fight it. It's a source of inflammation and it's killing us. And we know that. So a more useful fuel for our body are ketones. And humans have evolved to be able to survive periods of famine, whether that be winter or whether it be just not able to hunt well or something,
mm,
periods of famine. And to survive that, we call upon our fat, and the fat, when it's broken down, produces ketones, and it's a different fuel. The brain loves ketones. The brain is on doing great. And we can convert that in our path. We have multiple cool pathways to convert that fuel in a useful way to make ATP in our cells and keep our body functioning until that next meal.
mm,
So, and this ketosis is a very healthy state. Um, another useful fuel is lactate or lactic acid.
mm.
And we used to think that was a byproduct of exercise, make you have cramps. Well, the brain loves lactate.
Oh, go into that a bit more. That's because what you've just
Yeah,
said is true of me. I think lactate, when I train, the
yeah,
burn,
yeah.
um,
The burn is great
the
because if
lactate
you
system.
know, yeah, the lactate system. I mean, it's a great fuel. The brain loves it. The muscles use it. It signals pathways in our body that's that's the hormetic signaling in exercise is through lactate.
Oh,
You want that. You want to
yes.
work your muscles to just about failure. I mean, I'm now when I work out, I'm doing one set to failure instead of three sets. So my workout's quicker and I'm probably
Yeah.
getting more out of it.
Did you say you
Yeah.
do one set to failure? Is that what
One
you just
set to
said?
failure. Yeah.
Wow. And obviously a warm up first. Or
Well,
do you
yeah.
just
I mean,
literally go straight in
no,
like
no, no.
fail
I
and
will. I do that, of course. I usually do my
yeah.
cardio first,
Okay,
so
yeah.
I'm loose and things. But I will do one set to failure of triceps or biceps or something like that. And you have to train yourself to failure because we're so stuck in that,
Yeah.
10 reps mindset.
Yeah. So you say 10 reps, and then when you get to 10 reps, even though you can do five more, you just stop because you think, oh, I've done 10, I feel a little burn,
Correct. Oh
but
yeah,
that's
I've
not
gone
enough.
above and beyond. No, you need to do one set as if you will die if you
Yeah.
do not do the absolute everything you can with that last rep you shouldn't be able to finish.
Yeah.
And
Yeah.
your weight, you should adjust your weight so you're doing between 15 and 40 reps. That if you're going 70 reps, you're not using enough weight. If you're
Oh.
going 9 reps, you're using too much weight.
Hmm. This is really off topic, but it's just something I wanted to share with you. I was talking to a gut microbiome specialist, and he said that training to failure can change the composition of your gut
Yeah,
microbiome. And that, I
yeah,
was just like, oh my God. So I mean, I know to train to failure, but just you saying what you've just said, that it helps with stem cell activity and therefore in the long run, possibly anti-aging
yeah,
benefits. And
yeah,
then the gut microbiome can be completely transformed, with
yeah.
training to failure. Like it seems like a really important part of exercise, basically, for many reasons.
Yeah, I mean, I wish I had known this years earlier, but it's easier to put on muscle if you train to failure.
Mm,
That's where the work is done
it
in those
is.
last 2 reps. Yeah,
Yeah. And that's why you only need to do one set
that's
and
right.
then you just go and you've got all the benefits.
Yeah, I can get 6 or 8 different exercises in half an hour. It's easy.
Mm. Um, with the ketosis part, I just wanted to ask your thoughts on this. So, um, my podcast tends to evolve with me. So, if I tend to go on a journey, and then the episodes tend to reflect that journey. I'm kind of dabbling in the carnivore diet at the moment. And there's a lot of bad press out there about meat, like having too much meat, having too much protein, too much fat in your diet. And so therefore you'd think, okay, so maybe the general idea is that, a diet like that, for example, is probably not good for your aging and not good for inflammation. Do you have any specific thoughts? You've mentioned the keto diet, so I imagine the keto diet is beneficial. But what about something like the carnivore, which I suppose you can be in ketosis for that, but it's
Yeah,
so heavy in protein that you're probably
sure.
not sometimes. So do you have any thoughts specifically on that
Yeah.
or?
No, I'm a fan of the carnivore diet.
Hmm.
It overlaps with the keto diet. It
Yeah,
can, I mean,
yeah.
depending on what else you're eating. I'm a fan of getting enough protein and good protein. And the problem with the meat source, at least in the States, is it's it's not good. It's corn fed beef, and the poultry's got all kinds of growth hormones because we have these huge fat chickens, and that's not natural.
Yeah.
So we're eating bad stuff. If you have good meat with good fat in it, that's grass fed and doesn't have a bunch of hormones injected into it, doesn't have a bunch of pesticides in the grass, then you can do that. We should be eating lots of eggs. We
Mm,
should be eating good meat, lots of fish, as long as it doesn't have mercury in it. And
right.
you live somewhere where you have access to good seafood, I imagine. So
Mm.
that there's nothing wrong in my mind with the carnivore diet.
When it comes to supplements, then, so natural supplements, I have a personal kind of inquiry, and that is where does, if at all, NMN, where does that come into it? Does it come into it at all? Because I know NMN is very much for anti-aging, but is it a completely different pathway? It's dealing with telomeres and genes, and is
Yes,
is, is it
it
linked?
it's in the mitochondria, and
Okay.
mitochondria is a subset of the cell, and
Mm.
it's sort of a cell within a cell. If you take care of your mitochondria, you're taking care of your cells. So we like
Oh.
to do all kinds of different things for our cells.
Mm.
But NMN is specific to the pathway in the mitochondria
Right.
that produces energy. And the more efficient your mitochondria, the more efficient your cell. And efficient cells make fewer waste products. So
Mm.
they're less inflamed overall. So NMN is a great supplement. It's a little bit controversial,
Yeah.
but I do take NMN. You can take other supplements that do the work of NMN, like nucleotide riboside.
Mm.
These are all um, molecules that are involved in the same pathway, and there are multiple ways to enter the pathway.
Mm.
So I sometimes use NMN powder. I also take daily nucleotide riboside, so I'm probably getting it one way or both.
Mm. Are there any other supplements that you would swear by when it comes to stem cell health?
Yeah, I mean, well, not just stem cells, but so here's my afternoon package.
Oh,
So,
wow. So you don't
uh,
have a problem swallowing tablets. There's
oh,
probably
I
about
do.
20 in there.
I have to graze through these in the afternoon,
Oh,
after
wow.
lunch.
Yeah.
But I uh, I think the basic anti-inflammatory ones you that everyone should start with, if you're not already, is a great probiotic.
Mm.
We really need to help, unless you're in the dirt all day, in the soil, with the
Mm.
diversity and getting your hands dirty and what have you. You need a good probiotic, especially when we live in these sterile environments, sitting on the couch and eating
Right.
out of the cupboard. Um, Secondly, people by and large do not take enough vitamin D. Vitamin D is the survival vitamin. It's the only vitamin that's a hormone. It's highly anti-inflammatory and reduces all causes of death. And if you can reduce all causes of death, you'll live longer, right?
Right.
So, well, I suppose it doesn't reduce traumatic causes of death. So, but it's
Yeah, you
supposed to
can't really
reduce.
help that though.
It's published to have reduced all cause of mortality, so maybe it does
Right.
reduce your chance of
Right.
trauma.
Okay.
So I take 10,000 international units a day.
Yeah, that's
Um,
a healthy amount. That's definitely
it's
more than what's recommended by government guidelines.
because the government is just preventing malnutrition. They're
Yes.
They don't
Yeah.
want you to have rickets, which is a
Mm.
disease of too little vitamin D. 10,000 IU's doesn't mean you're at risk of having too much. I mean, people take 50,000 IU's. So I take
Yeah.
10,000 a day. I also get sunshine. Sunshine does convert some vitamin D2 to vitamin D3, but by itself is inadequate to
Mm.
make what you need for the longevity amount of vitamin D3. So take a supplement. It's easy to do. I take mine. It has some vitamin K2 in it,
Okay.
and that's a good mixture. I also take fish oil. I would love to eat more fish. It's just not easy to get high quality, good fish and prepare it and have it available
Mm.
in this modern world. So uh,
Do you eat
I take
tinned fish, or are you quite wary of that?
the farmed fish. Is that what do you
Just
call it?
tinned, like in a tin, in a
Oh,
can.
I've eaten plenty of canned fish, so
Yeah.
I don't have a particular worry.
Mm.
But we learn new things all the time. I may change my mind
Yeah.
on.
No, I mean, true. I mean, I struggle to get my omega-3
Yep,
up during the week. And so I've resorted to just having anchovies out of a tin. And I literally
perfect.
just take it like a supplement. Like I had half a tin one day, half a tin another, took a break,
Good for
then,
you.
next.
No, it's
I just
that's a
figured it's better than nothing, right?
great way to do it.
Yeah.
You have to have, be okay with the flavor of
Right,
anchovies.
yeah, it's very, very strong. But
Yeah, yeah.
I'm just that type of person. I'll just kind of do it quickly,
Nice.
and then I'm good. What about magnesium?
Wait, let me finish
Oh
one
yes,
comment
go
on the fish
on.
oil.
Yeah.
So I take 3 grams a day. I have patients taking more than 3 grams a day. We do not get enough fish omega-3 supplementation, fish oil being the main version of that. There are other kinds, flaxseed oil, things like that. You think about the blue zones where people live to be over 100, like Okinawa, they eat so much seafood. They have high omega-3 indices.
Mm.
That's the plural of index for those of you from the US. Uh, so if you want to get your indices up, your omega-3 numbers, you have to take a significant amount. Um, okay, and then what was the next one you were asking me about?
I
I'm so
just
sorry.
mentioned magnesium.
Yeah, and the
So
other
many
two,
people are a fan. Yeah.
yeah, the other two I take are bedtime medicines, supplements, and I take a multi-form of magnesium because, during the nighttime we do our repair, a cellular repair, like a plant does. We have a dark phase. We have at night we repair, especially if you're getting restorative sleep. Magnesium is required for so many cellular processes, including those involving DNA repair and things we do at night. So another good reason to get a good night's rest and to have your magnesium at bedtime. And then the last one at bedtime is melatonin. Melatonin is a hormone peptide that we take. It should be a dissolvable in your mouth and under your tongue. It should not be a swallowable
Why is
because
that?
you'll digest it into amino acids and it won't
Right.
be
Okay.
efficacious. So, and now we're sort of opening the door to the whole talking about peptides, but
Yeah.
melatonin is a peptide that you can use to help you go to sleep. But if you already go to sleep fine, it helps your cells repair better and it helps you sleep deeper, which you need to get that restorative sleep hygiene so your cells can repair and help you not age faster than you should. So a lot of these you think about it in the morning, you wake up, the light hits your retina, wakes you up, you secrete cortisol, the stress hormone, so you get stuff done. Cortisol is pro-inflammatory. So we're
Mm.
inflamed during the day, we're inflamed as we're eating. At night, you should go to bed fasted, meaning nothing, after dinner. And then you take your melatonin, and because after puberty, you sort of stop making melatonin. So you
Mm.
take your melatonin. I take 12 milligrams at night, and you help offset that cortisol. It's sort of the opposing hormone to cortisol. And we have,
Mm.
like any cycle, you cortisol in the daytime, melatonin at night.
Right. And so cortisol is highly inflammatory, which is highly, which will cause you to age faster, and therefore it's
Correct.
affecting your stem cell activity, I imagine.
Probably anything pro-inflammatory or
Mm.
pro-stressful works against the stem cell
Yeah,
activity.
that's
Sure.
right. Okay. Jeff, I feel like I've learned so much more about stem cells, and I feel definitely more clued up on the topic.
Good.
So is there anything that in this conversation that you think that it was quite big that we just didn't quite cover, that you didn't talk about? Um, is there any
No,
lasting thoughts?
I think that anyone out there with a disease problem, with a joint or spine problem, with who just really wants to be on top of a plan to live longer. Maybe you have 13 grandchildren and you want to see them all, grow and develop, and you want to be on this planet longer. You have to do the work. And
Mm.
you can look at regenerative medicine or stem cell based options. And if you ask your doctor, and the doctor is not trained in that, because I wasn't originally trained in that, I had to go back and do that. Um, you just need to ask another doctor.
Okay. Well, thank you so much, Jeff. How can people follow you if they love this conversation? How can they continue just
Well,
researching?
our company is called Recelebrate
Yep.
because we are celebrating the renewal of your cells
Mm.
through regenerative medicine. So you can find us online at RECELLEBRATE. And that's our website, recelebrate.com. It's our Instagram, our Facebook. Just type in Recelebrate and you'll find us.
Lovely. Well, thank you so much, Jeff. That was fabulous. And hopefully we get to chat again soon.
I would love it. It's been my pleasure. Thank you.